Hi, in the last video we had discussed about the coronary supply of the heart, also known as the arterial supply. But in today's video we are mainly gonna focus on the venous drainage of the heart because the blood supply of the heart is incomplete unless we talk about the venous drainage. Now after supplying the myocardium, the blood needs to be efficiently collected and returned to the right side of the heart. Just like for the rest of the body, all the deoxygenated blood is returned to the right atrium by the SVC and the IVC. There is a specialized mechanism through which the deoxygenated blood from the heart muscles are returned to the right atrium. Now, there are different ways through which the venous blood is returned to the right atrium. But the principal way is through the coronary sinus, which can be located somewhere over here. And by the way, this is the posterior view of the heart. The coronary sinus is the principal venous channel of the heart, and it lies in the posterior part of the atrioventricular groove between the left atrium and the left ventricle. This is the atrioventricular groove where the coronary sinus is situated. Now, various tributaries are also present for the coronary sinus, as you can see at the left-hand side of my screen. It is also important to note that the coronary sinus is guarded at its opening on the right atrium by something called the Thebesian valve. The coronary sinus is formed by the confluence of two veins. One is the great cardiac vein, which is better seen in the anterior view, the great cardiac vein over here, as well as something called the oblique vein of left atrium, which is not really seen properly in this diagram, but it is present in the posterior view and is responsible for draining blood from the left atrium. So if we zoom more into the great cardiac vein, we see that it starts somewhere near the apex of the heart, and then it passes through the coronary sulcus, and which also accompanies the circumflex artery. Also, before that, while passing through the interventricular groove, it accompanies the L-reed artery, the left anterior descending artery. Now, after going through the coronary sulcus, it drains into the coronary sinus, which is over here, as already marked. This is the great cardiac vein, this one. Now, as you can already see on the left side of my screen, I have listed all the various tributaries of the coronary sinus, and we have already discussed about the great cardiac vein and the oblique vein of the left atrium. Now, if we proceed to the posterior vein of the left ventricle, which is also a major vein, as you can see over here, this also drains into the coronary sinus, and it is responsible for draining the deoxygenated blood from the inferior and lateral walls of the left ventricle. After this, we have something called the small cardiac vein. The small cardiac vein accompanies the right coronary artery, as we had discussed in the last video, and it drains the right side of the heart. And it goes in between the right atrium and the right ventricle, right here. Now, when we are discussing the small cardiac vein, it is important to mention the right marginal vein, which can be seen in the anterior view like this. It is over here. The right marginal vein is a tributary of the small cardiac vein in 33% of the cases. It is a tributary of the small cardiac vein. This is the small cardiac vein. It is a tributary in 33% of the cases, but in 2/3 or 66% of the cases, which is the majority, it directly drains. This directly drains into the right atrium. So this is trivia. It is similar to what happens in the coronary dominance, where the ratio is 90:10. We have discussed about it in the previous video. Kindly check it out. Now, talking of the right marginal vein, it is important to also mention the left marginal vein, which is directly a tributary of the great cardiac vein. And in the anterior view, you can see over here, this is the left marginal vein. And it is responsible for draining the deoxygenated blood from the inferior and lateral walls of the left ventricle. This is the left ventricle in the anterior view. Among the tributaries of the coronary sinus, we are just left to discuss about this one. It is called the middle cardiac vein, and this is also known as the inferior interventricular vein, because it is present on the inferior surface of the heart and situated between the left ventricle and the right ventricle, hence the name interventricular vein. Now, as you can guess, it drains deoxygenated blood from the inferior walls of both the left ventricle and the right ventricle. So that wraps up the coronary sinus. But it is important to note that not all venous drainage of the heart passes through the coronary sinus. There are namely two other ways. One being the anterior cardiac veins and the Thebatian veins, or also known as the venae cordis minimi. The anterior cardiac veins are a series of 3 to 4 small veins that run parallel to each other, as you can see over here. These run parallel to each other, and they run across the right ventricle over here. This is the right ventricle. They run across the right ventricle and ultimately drain into the right atrium. So they are basically bypassing the coronary sinus. And other than that, as we mentioned, there are also presence of venae cordis minimi, or the Thebatian veins. And these are very extremely small veins that cannot be seen in the diagram given. But they are present on the walls of all the 4 chambers: the right atrium, the right ventricle, the left ventricle, and the left atrium. And they drain directly into the respective cardiac chambers. These Thebatian veins are more numerous in the right atrium than the right ventricle, and they contribute to the normal physiological shunt. More about shunt in the following videos. The venous system of the heart generally follows the course of the coronary arteries. However, venous anatomy shows greater variation compared to atrial anatomy. And also there is a very interesting fact, that is, unlike the arteries, the cardiac veins, they lack valves. This is a very important thing to remember, that the cardiac veins, they lack valves. So we have reached the conclusion of this topic. Hope you learned something. I would be glad to get your feedback in the comment section. Thanks a lot for watching, and meet you in the next one.